So we have classic plantar fasciitis.
Do you want me to lay down or am I sitting?
We're gonna actually have you from like a side point, kind of clean face straight along. So we'll have you face down and prone. But first, describe this a little bit for us. So anybody that doesn't know plantar fasciitis, this is a super common one, and I'm gonna start off with all stuff. Let me move this out of your guys' way. All massage stuff and rehab stuff related to plantar fasciitis. It's pretty inconsistent, right? Like, I'm sure you've tried everything.
I roll it on balls or stretching. I've seen actually on Amazon, they have this contraption you can put on there and it's got a strap from your toes to your shin.
Yeah,
and, like,
to try to stretch everything.
Yeah.
Yeah, I have an easier one if you get the sweatpants that bungee, and you get them a little bit too short, you can tuck your toes in there.
Oh.
and then you got like a nice tension for your toes to bring them up and hold them there.
So I mostly just have pain that goes from like the edge of my heel here and it shoots up this.
Yep, so that's where the plantar fascia attaches. That's why I have these models. Is at the calcaneus, the edge of the calcaneus. Now this is underneath. The plantar fascia is more of a ligamental structure underneath these muscles that splays out and goes onto all the metatarsals. And usually, has anybody else felt a plantar fasciitis? It's a nasty thing, right? So if you're still for a long duration, especially in the morning, you'll try to stand and walk on it and feel like somebody's stabbing you. Just gah, like a little gremlin, just gah. And it hurts and it's terrible. Now when usually you move, it warms up, it's fine. But the reality is that it's a real difficult thing to treat. And we can do some temporary relief things, but you as the therapist have to be open to the fact that the interventions related to plantar fasciitis are very middling in terms of their effectiveness. Now the tape, who knows? If part of the symptom is inflammatory based, maybe. All right, now I just had the model. Yeah. The other things related to the ankle that we're thinking about. So in your form, what you can't see is the bottom of the foot, okay? So if we're looking at this form real quick, I'll hand you one for now. Is that make sure I'm doing this right. Yeah, the blue and red ones, 1 and 2, because that's how I have this oriented here. So 1, 2, and 3 will be the order I'm usually suggesting this on. The bottoms of the red and blue pieces are going to go over that. The anchors will be on the base, like kind of not quite all the way to the arch, but at least there. They'll be starting here and then coming over top of that hurty spot. Remember I said we want the stretched part of the tape on the hot spot, on the trigger point, on the angsty tendon, on the angsty ligament. We want the stretched tape on it. So the anchor then has to be down here, then stretched. And while we're putting the tape on, we might as well help an Achilles out. So if you do 2 pieces of tape stretched over where the plantar fascia attaches on the calcaneus, that's the most common place for this to occur. Mine happened more in the arch, but usually it's more here at the attachment of the calcaneus. So 2 pieces of tape covering that, and then going on either side of the Achilles. Might as well get 2 for 1. Now the Achilles, what are the muscles that do that attach and become the Achilles? What action does that do at the ankle? Students in the later group, what does it do? Flexion. Plantar flexion. Shortens. Achilles tendonitis, also super common, and the 2 coming together is also pretty common, okay? There are muscles here on the medial side, and there's muscles on the lateral side of these bony landmarks. So there's the calcaneus, what we call the heel. That is the bottom of the tibia. That is the bottom of the fibula. But as a bony landmark, they're called the medial malleolus and the lateral malleolus. If we tape just posterior to those, see how we would be getting not just the Achilles, but maybe be affecting those muscles are underneath the ones that become the Achilles. They go behind there, think of that as the tarsal tunnel. They go between the calcaneus and medial malleus into the bottom of the foot, into the arch. All right? So we want to have our tape here a little bit if we can, and over here, because 2 of the fibularis muscles go there as well. So can you see the methodology of, like, if I'm going to do tape for one, I might as well get good at taping for something here that will help a lot of issues, whether it be plantar fasciitis, repeated ankle sprains, or Achilles tendonitis. That formula will do it. Now, the pieces of tape on the bottom of the foot are problematic because they'll roll up. Thus, the other piece of tape, that green piece of tape, is going to go on like a shoehorn to hold those anchors down. It's going to go on like that and wrap up on either side. So that's, and then you can make use of wherever that tape goes to affect the rest of the ankle if you can. So the order here doesn't have anything to do with the effectiveness of it. So thinking about all this stuff, it's perfect. Left foot, left foot. Now, how could we incorporate some massage that would potentially affect the things that cause plantar fasciitis and a lot of the issues relative to the ankle? I've talked about these muscles at length. These deep muscles under the Achilles love to get stuck to the muscles of the Achilles, and finding a way to affect this medial line is essential. It gets under-addressed in massage because people don't know how to work on the leg in any other position than prone. And even in this position, they seem to not know how to get to the medial part of it. So we have to be sure we're affecting this and unsticking this group, not just soleus and gastroc. We gotta unstick this, and we gotta unstick this. And your best positions actually are going to be in sideline, because you'll naturally have a good angle on that. You work on the leg like this in sideline, you're naturally gonna be separating that. The top leg, naturally gonna be separating that. I'll show an adaptation of how to do it in prone. I don't suggest doing it in prone. I suggest taping the ankle in prone though, because you have the most versatility there for your body mechanics. All right, so we want to think about those muscles, medial malleolus, lateral malleolus. Now, as I'm doing some of the massage, just try to visualize Achilles muscles. The big ones are gastrocnemius and soleus, and then this deep group, which are the antagonists to this group. Tibialis anterior, tibialis posterior, extensor digitorum longus, flexor digitorum longus, extensor hallucis longus, flexor hallucis longus. Right? Then the fibularis group. There's 3 over here. Longus, brevis, tertius. 2 of the tendons go on just behind the lateral malleolus, the other one goes on the front. But that's all of the stuff here. That's everything that does everything outside of the intrinsic muscles of the foot. So it's just a big, big thing about saying you gotta remember this lateral compartment and this deep compartment, right? All right. A lot of times alcohol sprays, but that can be a little irritating on the skin and everything. That's where the hot towel will be the big win. Now I'm gonna use it, one, because it'll be nice. Good for my hands. We're trying to warm and lengthen everything here. So, okay. Hot towel coming in.
Oh.
It's such a lovely thing. It's a great way to start your sessions. I can't begin to tell you enough if you want like a nice nuance long-term in your clinical space, that you can just microwave the hot towels. Right? Just starting a session real quick with this. They cool off quick, but great little thing to add. Now this is already, because of the temperature, helping warm that superficial fascia. So I'm going to use one. I'm using this one to, now I don't have lotion on. It would clean the lotion oil off of their skin and my skin. And now look where I'm standing. This is the big trick. Like we can be here. We could be standing over here. We could be standing here. But the big trick I have for you is here. And I may have to position their leg a little bit, bring it closer to me, stuff like that. But this is how I can get a better angle for that medial compartment. I don't know how good that's able to be seen right there.
I think all of a sudden I have it in both feet.
Oh.
No, that makes sense.
Now, this would be more gentle. If I wanted to get aggressive, I can lower my stance, I can get seated, turn my hand over, use my knuckles kind of like a wedge, and come in on that ankle. So there's no excuse, even if you're not going to use side lying as much as you should, to not still be able to work on the medial aspect of this lower part of the leg. It's one of the most under-addressed regions. Doesn't matter if it's about repeated ankle sprain, this ends up getting way too long with most repeated ankle sprains, and that means the other side is way too short. So if we want to balance that out, we got to work like this. This is also one of the best positions for the foot. Rather than standing like this, especially if they're really short, you're going to be reaching, you can't get to their foot. So over here, now we know that calcaneus is an issue. The Achilles tendon attaches onto the calcaneus, and the plantar fascia attaches onto the calcaneus. So could the two be involved with each other? Absolutely. That's why always you should think about the Achilles relative to plantar fasciitis. I had some pretty solid effects with the athletes related to this, and it was this. The only trick is that I didn't focus treatment there. I did all of this and this. And then I was the all-star because I was the one that did the calf stuff rather than just saying, roll your foot on the golf ball. Okay? So I'm trying to kind of open that space up. I'm thinking that medial malleolus to the calcaneus, that's that tarsal tunnel section. I'm trying to just open that space up. This is where myofascial stuff comes into play. I can't have lotion, or at least very, very little, in order to pull this off. Now this would be best in sideline to be sure, but I'm just wanting to show some adaptations. Okay, gonna move the calcaneus around. If I just grip it, stabilize the calcaneus, and move the rest of the foot. I could be moving just the tarsal bones if my hand's higher up. That's a little bit harder on my hand. Or I can just grab lower onto the metatarsals and roll those around. But I'm trying to get that calcaneus moving relative to talus and navicular and cuboid, all that stuff. You can learn all the names and you have to memorize them. But the grand trick I have for you is squeeze calcaneus, move the rest of the foot. Because if the calcaneus is pliable relative to the rest of the foot, then all the soft tissue structures that attach onto calcaneus are going to be made more pliable. And I can swoop around and do it again. Hug calcaneus. The distal, proximal, the proximal aspect of the fifth metatarsal, your pinky toe, has this big bony protuberance, okay? And then there's muscles in between. So there's a little gap right here. So that's where my hand is set. I'm just proximal to that, still hugging the calcaneus. Okay. Massage has been done. Now, some other things that I could do here. Again, sideline would be best, but here. Note how I'm using my forearm. I'm not here. If I'm here, I'm gonna just lose all my pressure. So I have to start my application really close to my elbow. It's not this, it's this. That's how I will get a good application here. I would do a better job in sidelines solely because I wouldn't be reaching so much. Okay. And you be thorough, do all the massage, and worst case scenario, you have to maybe reposition the person in prone, and then do the rest of this. Okay. What's nice in prone is that here is where I can have all the joint movement required to apply the tape correctly. So I have to here, 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 all that. So I need the plantar fascia on tension. Thus, I have to have the client do the work for me. So she has to hold her knee there, hold it. Okay, foot like this, toes up. I want that as stretched as possible, okay? So it's related to the toes and the ankle. So go ahead and relax while I get the tape ready. But that'll be the goal here. I tend to tear the anchors in 3 portions. So I tend to tear the backing of the tape in 3 portions, the anchors and then the middle of the stretch part. That tends to be my pattern to make this easier. So here, okay, hold the foot like that. All right, there's the calcaneus. That's where it attaches. Is that pretty close to where it hurts usually?
Yeah.
Okay, I want to really like put a bullseye on that. That's where I need the stretch part of the tape to go on. So I need the anchor well below that. Relax your foot a little bit. The bottom of the foot, I want to be really sure that the tape is adhered and we don't have like a strange wrinkle in the tape in the skin of the foot. Okay. Also giving her just a small break. Okay, foot stretched again, toes up. Okay, now this one, I'm going to go pretty full tilt. This is a pretty tough region, so I go pretty close to 100% on that. Okay, I came all the way down. See how I'm just past it? The other anchor came off. You're going to relax. Now, just so I'm out of the way, I would usually be applying over there, so you can see. I'm going to try to be on the medial portion of the Achilles. So if I'm going to be really thorough about this, I'm going to have her go like this and then over. Tipped over, yep. And then I'm going to bring that over. I would prefer that be a little bit more medial than it is, but it's okay. Then 0 tension on this anchor, down. Then go ahead and relax. And then I'm just looking for any skin wrinkle, any crimping or wrinkling in the tape. Okay, first one down. All right, next one. Oh, I did that wrong. I just messed up. Now I gotta fix it. It's not that big of a deal. Just toes up, foot taut. Very good. Here. Back backing. Okay. Holding. Okay, relax. Okay, just letting everybody see how dividing up that backing can make it a little bit easier for yourself, because then you can just worry about taking one section at a time. All right, now again, tension, over a little bit, okay. Here, the order of these doesn't matter as much. If you see this hand is really trying to keep that ironed out, because as you pull, it wants to crimp. So this hand's holding down, and I can find that lateral malleolus. Okay. Here, and 0, 0, 0. Make sure there's no wrinkles. Okay, good. Now comes the shoehorn. You're going to let your foot down. The ends of the tape there is where this stuff loves to roll up. So the way we're going to apply this next one is going to, and you have to kind of just be open to, based on where the tape is, like I'm going to have to be a little bit adaptive of like how I'm going to get this set up. I'm going to come over and I'm going to go on the anterior side of the lateral malleolus. Kind of doesn't matter exactly where, but I know that that's where a bunch of other tendons and muscles live. And then I just kind of will trace that, and I'll always be trying to follow the anatomy. Maybe the way the tape like plays out as I'm laying it down, doesn't quite go exactly the way I wanted it to, but just in real time, just think about whatever anatomy you're going over and follow it. All right. My goal here for the bottom of the foot, though, is going to be to hold those anchors down. So go ahead and hold foot on tension. That's where I can take the whole backing off like this, hold it like this, and then make sure I go right over top both of those. That'll help hold those down. All right, and first one, go ahead and relax. Now I have to stretch the other side of the foot though, don't I? So that's where more movement comes in. I come over. This one's just gonna kind of come around to the front of the foot. It's not gonna do anything too spectacular. I'm trying to get it to go more up the tibia. Zero on the anchor. Okay. Then foot over like that. Now I can try to, I'm not going to have probably enough tape, but my goal would be to try to cover as much up to that lateral malleolus. Right here. Watch that skin. See how if I pulled real hard, how it starts to create like a skin roll here? So I might want to just hold that down, bring it down. Go slow, but you can't go slow if you don't do the, take out the backing off in stages like this. If it does try to roll over for you, you can kind of pull it off, get it restuck. There we go. Okay, then 0%, down. Ended up working out kind of nice and those, looks like a little hug. But you never want to lasso a person, right? I never want to go full tension around something because you'll create a tourniquet. We don't want a tourniquet. And that's the basic formula. So on the bottoms of the foot, even if it was just a piece that had to do this to hug around the front, I probably would have preferred, if I could, a longer piece of tape so I could have had this come up a little bit higher, especially if there was more ankle stuff going. If there was more ankle related issues, especially repeated sprains, I may not worry as much about this one. I may do like 2 of those. I could start here and go that way, and then here, go that way. You know, you can be pretty inventive, but this usually covers it all, but that would be the only other adaptation I could think of, is to do that same application with a longer piece of tape, go right over that calcaneus attachment, and go on both sides posterior to the malleolus, and then do another one that went at least anterior on this side, and then you make it up on the other one. And that would cover a lot of bases too. All right, let's get you up in gravity and see if that's miraculous or not.